Is it for me, guys. I'm out of here. But again, thank you for watching. I'll see you next time. Bye.
Good day, folks. Thank you for joining us here at Your Health. On today's program, we will be taking your calls for the entire hour. Get on the phone, give us a call. I'd love to talk to you. I think we can make a difference for you, but I got to talk to you, so call us. But first, let's go to our news. Let's see what's happening in the health world. An indigenous group of South Americans known as the Tsimane have the healthiest arteries of any population study to date. The Tsimane are forager horticulturists residing in the Bolivian rainforest of South America. A typical 80-year-old Tsimane has the arterial structure and health of a typical 50-year-old North American. The study used coronary artery CT imaging to assess arterial health. Overall, the study found over 85% of the Tsimane people have no risk for heart disease whatsoever, compared with over 85% of Americans having at least one risk factor for cardiovascular disease. Well, folks, this is a fascinating approach to the study of disease, an approach I have long thought we should do more of, and that is, let's study people who are exceptionally healthy so we may learn their secrets. Now, here we have the Tsimane tribe who live in the rainforests of Bolivia. They are hunter-gatherers, and their diet is mostly made of whole grain rice, plantains, manioc, which is also known as cassava, a starchy tuber, maize, a plant distantly related to our corn, nuts, fruits, fish, and wild game. Their diet is very low in saturated fats, and sugar is virtually absent. Nothing is processed or preserved, so it's full of fiber. It is also gathered and prepared by the family units. They are extremely active, with only 14% of their day spent in sedentary activities, while we spend over 50% of our days sitting. The researchers report they are relatively certain that Tsimane's low rate of vascular disease is not due to a unique genetic trait, but rather their unique way of life. You see, modern times have made headway into the Tsimane tribe. Motorized boats and new roads have brought changes to their ancestral homelands. Modern progress has brought dietary changes that have begun to increase the rate of cardiovascular disease among the Tsimane. But for now, these unique people rarely have any heart attacks or strokes, and it is because of what they do on a daily basis. What they eat, what they drink, their activity levels, and it's not due to some medication they take. This is a wonderful example that proves we can prevent disease and improve the health of our daily lives. Taking higher doses of vitamin C may be more effective in reducing the severity and duration of the common cold. There have been many previous studies that confirm vitamin C improves the symptoms of the cold, but these studies have all used doses ranging from 500 milligrams to 1 gram daily. Researchers from the University of Helsinki wanted to know if taking higher doses of vitamin C is more effective in combating the most common infection suffered by humans. They devised and compared the results of two separate studies. The first compared the effect of taking 3 grams of vitamin C a day versus 6 grams on the common cold. They found 6 grams daily shortened the cold by 17%, and that was twice as effective as 3 grams. The second study compared the effect of 4 grams versus 8 grams of vitamin C on the cold. Taking 8 grams reduced the cold by 18%, and that was twice as effective as 4 grams a day. Researchers comment taking 15 grams or more of vitamin C a day may be very effective in shortening the duration and the severity of the common cold. The study was published by the journal Nutrients. Folks, vitamin C is one of our most studied nutrients. People have been taking it to help prevent and treat common cold for many, many years now. However, most of the past research has used relatively low doses of vitamin C, but this study wanted to know if more vitamin C was even more effective, and sure enough, they found a linear relationship with vitamin C dosage and relief from the cold. Now, some things you should know about vitamin C. As we increase our dose of vitamin C to 10 or more grams a day, be aware that some intestinal upset may occur. The dose at which this upset occurs is known as our bowel tolerance dose. If we keep our daily dose below the bowel tolerance dose, then we reap only the benefits of vitamin C on the common cold. Also, when we become sick, our tolerance of vitamin C increases, reflecting our increased need for this immune-enhancing nutrient. A good approach is to take 1 gram of vitamin C every 2 hours while you're awake as soon as you think you're coming down with a cold, at the very first sniffle. Drink plenty of water so there's no risk of kidney stones, and relief should come soon. It works, folks. Give it a try the next time you have a cold. I'm sure your health will improve quickly. Well, today, as promised on our program, we will be taking your calls. Stay tuned. We'll be right back.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online or call 888-442-1828 and let BioInnovations assist you in making the right choices to better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. High cholesterol raises your risk for cardiovascular disease, but it's just one risk factor among many. And the need to lower your cholesterol can be over-exaggerated. Everywhere in the media we see advertisements for cholesterol-lowering prescription drugs. It's a big business. Now, cardiovascular disease kills more Americans than any other disease, so we need to pay attention to all the risk factors for heart disease. Here's a prevention strategy. Besides lowering your cholesterol, treat high blood pressure. Stop all tobacco, manage diabetes, exercise regularly to stay fit, avoid sugar, eat fish and fresh fruits and vegetables. Take your daily vitamin and use omega-3 oils. Address all your risk factors, not just your cholesterol. For Your Health at a Glance, I'm Dr. Richard Becker. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers 2 products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings. Welcome back, everyone. It is fantastic to be with you today. We are going to be taking your calls the entire hour today. So if you haven't tried, today's a good day to pick up that phone. Dial 800-635-2673. Well, let's get right to it, shall we? Let's go to Louisiana and welcome Ted to the show. Hi, Ted.
Hey, how are y'all doing?
Pretty
Great.
good. How are you, Ted?
Well, look, Look, I thank my Lord and my Savior, Jesus Christ, for you, Dr. Richard, and Miss Cindy Becker, for the work that y'all doing and the way people are being blessed by it.
Well, thank you very much. I hope I can help you today. What's on your mind, Ted?
Okay, I've been having the MRSA virus since mid-December, and I've had a full treatment. I think it was 9 weeks of antibiotics, and then it came back again, and I'm on 6 weeks of it, but she just extended it 2 more weeks of the antibiotics. And I'm wondering if anything could help me with this MRSA virus to get rid of it. It's in my back, my lower back, and in the deep tissue, they said, in the bone area, in my disc.
Yes.
And I've had 2 previous back surgeries way back in 2002, and my discs are bad, but this virus is making my back hurt so bad.
So,
and I don't
Ted,
have
let me ask you some questions here. Did you have a recent surgery?
No. Yeah, I had a thoracic surgery over my chest area, over my heart area, because there was a lot of infection from that virus in that area.
Okay. All right, just so you know, the MRSA, methicillin-resistant Staph aureus, it's a bacteria, but that's not as important as getting you better. Is there anything else complicating your history? Because such a persistent infection usually happens in someone who perhaps has a compromised immune system for some reason, such as diabetes. Are you diabetic?
Yes, I'm type 1 for 46 years.
Okay. How is your diabetes control? What are your glucose numbers? Are they good?
Well, lately they've been up and down. I don't know what's happening with it, but my food is very slow to digest, and my food don't taste good anymore. You know, I don't know if it's because of all those antibiotics.
Yes.
I lost a lot of weight, and my bowel movements aren't good. You know.
Well, you've had multiple weeks of IV. These are IV, correct? Intravenous?
Yes, through a
Yes.
PICC line.
Yes, and you know, it's not just oral antibiotics that affect the bowel flora, it's any type of antibiotic. Even topical antibiotics, if used daily for a long period of time, can lead to bowel flora changes, bacteria changes. Ted, here's the thing. Oftentimes, when we have a persistent infection that won't go away in spite of the world's best medicines, it's because the infection's not really due to methicillin-resistant Staph aureus. That's what they culture. But the real problem is that you have a yeast or fungus infection in your operative site. And what happens is you can have an old wound. Say you had a back surgery 10 years ago, for example, and then they have a fresh surgery on your thoracic area, something, and that becomes infected. What happens, this potential can happen, the bacteria will be transmitted through the bloodstream, and it seeds an old wound, and it becomes infected as well, especially if you're diabetic or you're in cancer therapy or something that inhibits your immune response.
Right.
So there was a study done recently, and I wish I could tell you what journal and what institution, but it was reputable. And they found when people have infections like yours, the most of the time, the majority of the time, the real problem is they're overwhelmed with a fungus. Yeast infection. You got a yeast infection. If you include that in your treatment, you'll probably get well. Now, your blood sugars are going up and down because of the stress of the infection. And the stress of the infection is causing the blood sugars, and the blood sugars cause further immune inhibition, which cause continued infection. So you get in this cycle, and it can't be stopped. And Ted, I don't know if your doctors have told you this, but you're in a life-threatening situation. You know that, right?
Yeah, they did tell me when I first went in the hospital, it was pretty serious.
Okay. Okay, next question. Have you seen an infectious disease expert?
Yes, I'm seeing a doctor for that right now, and she's the one giving me the antibiotics.
Okay. Do you know the name of the antibiotic you're taking?
I'm sorry?
Do you know the name of the antibiotic they're giving you?
Vancomycin.
Yeah, that's the standard backup big drug. It's very powerful, very expensive, but usually effective. And, you know, the success rate with that drug with what you have should be over 90%, and it's not working. So here's what I would do. I wouldn't just use natural agents. If I were in your situation, I would also add to that regimen fluconazole and terbinafine. These are antifungal drugs. The trade names are diflucan and Lamisil. That's easier to remember.
Okay.
You know, you could say to your doctor, you know, I've heard from the scientific literature that often these persistent, hard-to-treat infections are actually a fungal infection, and if you treat for fungus, most of the time they go away. Okay?
You know, doctor, just before I got all this, my diabetes doctor had put me on fluconazole because I had broke up with some little rashes, but it was cleared up for a few months before I caught this.
Yeah, but you can't get rid of it completely. That's the nature of fungi and yeast. See, the bowel flora contains all these organisms, even in healthy individuals. When you're healthy, they don't cause infection, but something happens, like for you, and then all of a sudden, you're overwhelmed. Now, I also want to send you some naturals to complement the treatment, because I don't know if you've noticed this, but it usually doesn't work very well when you go in and tell a doctor how to treat you. Have you noticed that? That doesn't work.
Well, my infectious disease doctor don't believe in natural stuff too much.
Well, you may have to find a new doctor. But all I'm doing is telling you from my experience what I've learned and what the current literature is telling us.
Right.
Now, you can do this on your own. I don't see a problem with it. Many diabetics have done what I'm going to tell you to do here without a problem. And in fact, things improve in their life when they take charge and control their glucose with natural methods. This doesn't mean you set aside medicine. These things go just fine with insulin therapies. Type 1 diabetes, they're on insulin. Oil of oregano, take it orally. And take it with every meal. At least 1 or 2 of the gel caps with every meal. Olive leaf extract. These are capsules. I would take 4 with every meal. Really push it. I'm going to give you two of each of these so that you have enough to get a good start. But I would also add, you're fighting for your life, buddy. You're not going to get many more chances here. I would also add the diflucan and the Lamisil to this. What else? Noni. Noni is it helps to control the glucose levels, and it has natural antibiotic and immune boosting properties. If your immune function were working better, you could fight this off better. Probiotics. Eat yogurt with every meal. Low sugar. You know, no sugar added yogurt. Get used to it. Get used to it. Add a little of your own fruit. And take probiotic supplements with each meal. This is very important. We've got to change the flora, because the problem is in your gut, Ted. Problems in your gut. Change the gut, everything else follows. You need the mushroom complex. The beta-glucans in the mushroom complex improve the immune response. You need a good multiple vitamin and mineral. Your whole problem could be because you're zinc deficient and you can't mount an immune response. I would hate to see that happen. Zinc, it's cheap. So a quality multiple vitamin that has the zinc, the vitamin A, the immune-dependent system is very dependent on those nutrients. How about vitamin D? I would take 10,000 units a day for a month and 5,000 every day. I'm going to send you some vitamin D. And how about 2 or 3 grams of vitamin C every day? I also want to send you Foundations for Healing. Has a whole chapter on diabetes, how to control it, and the whole thing's written about how to deal with these chronic yeast and fungi infections, and you need that. So this is what you have, Ted. You have a yeast problem. There's a fungus in those wounds, and it's confusing this system, and you're not getting over it because of that. This is how you get well. You may need a new doctor. I don't know. All I know is how to get you better. Hang in there, buddy. Your care pack. Yes, go quickly. Go quick. Yes?
The last 3 weeks I was in, they had put me in a nursing home to do some of my antibiotics, and I was throwing up and that, and the doctor did put me on nystatin for 10 days. So
that's not quite enough. And the reason that's not enough is it stays in the gut. It doesn't go into the periphery, into the tissues where the fungus is happening. The diflucan Lamisil will. Now, you have to be followed with blood tests when you do this regimen. So this is not something you can do on your own. The naturals are fine, but the medicines, you know, doctor has to manage that for you. You can't get those without a doctor's help.
Doing blood tests
right
now.
The truth is in there. Okay, we communicated, Ted? This is critically important.
Oh, yes, doctor. You really opened my eyes to some things.
You be strong. You hang in there, and you will find help. I assure you. Hang in there. We have a break. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
So call 888-442-1828 or go online at bioinnovations.net to place your order. Ask about the AutoShip program for additional savings.
Because chances are you are one of the 200 million Americans who need more magnesium every day. I'm Dr. Richard Becker for Your Health at a Glance. Do you have a family history of a certain disease? Scientists are discovering that our genetic code plays a smaller role than previously believed. Only about 20% of disease is tied to our innate genetic code. So what determines the other 80%? The answer may lie in the emerging field of epigenetics. What is it? Epigenetics is a group of changing factors responsible for both how our genes are read and how they are then applied throughout the rest of the body. And this may explain why identical twins with identical genes can have different health problems. Researchers believe 2 of the main factors in epigenetics are nutrition and environmental exposure to toxins. So eat a healthy diet, reduce toxin exposure, and you may improve your own epigenetics. For Your Health at a Glance, I'm Dr. Richard Becker. Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's BioNutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-1828 or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings. We're back, everyone, taking your calls the entire hour today. Let's go to New York now and welcome Anna to the show. Hi, Anna.
Hi.
Hello, Anna. How are you today?
Oh, I'm pretty good. I wish I was better.
Okay. Well, maybe we can help you. What's on your mind? What's the problem?
Well, I'm 94 years old, was very active, have a very good mind, but I have this very excruciating back condition for the past 11 years.
Okay.
I have narrowing of the vertebrae, and it's filled with spinal stenosis.
Spinal stenosis.
Mm-hmm.
Yes, that is painful. What have you done to help yourself?
I had 6 epidurals. I have a basket filled with all kinds of rubs, and I take vitamins. Every one that you mentioned, I take.
Anna, did you say you've had 6 epidural injections?
Yes, none of them worked, and I don't know if they had looked at my, what do you call it, the x-rays, they would have found that they were useless, because if the vertebrae is filled with spinal stenosis, how can the medicine go through, do any good work?
Yeah, well, I understand that concern, but somehow it does. if 6 have not helped, don't take any more. In fact,
No,
I
I'm
think
not going to take any more.
I think you've had too many. Let me tell you what we're doing with epidural steroid injections. They inject a long-acting steroid. It's a salt, they call it, so it doesn't dissolve. And it stays in that epidural space for 3, 4, 6, 8 months. I've personally seen it in that space 6 months later when the patient says, that didn't help, we need an operation. You go in there and hey, there's the crystals, they're still there. So usually doctors take the approach, if 3 do not help, a series of 3 over a 6-month period of time or so, if that doesn't help, don't do any more. In fact, really the figures are about 70% get some help with the first one. If we do a second one, another 30% may get some help. If we do a third one, another 10, 15%. After that, there's no improvement at all.
Well, I have Paget's disease, and I've known that since...
Well, that's why you have stenosis. You treat the Paget's disease. Who's treating your Paget's disease?
No one right now.
Oh, honey.
I was under a endocrinologist, and...
Well, hold on. Slow down, Anna. You know, everybody's going, what? What's going on? Paget's disease. With Paget's disease, we have the abnormal deposition of bone. The bone builds up. You get big nodules, and this happens in the spine. And in the spinal canal, where there's supposed to be room, the bone builds up and it pinches your nerves. This can be managed. To control the Paget's and no more steroid. They're killing you with steroids. Look, we just had a study that came out. If you've had a steroid injection within the last 3 months, your risk of blood-borne septicemia, life-threatening bacterial infection, 5 times increase. Now, it's still a small chance, but with increasing age, your risk of infection increases anyway. With these comorbidities, these other health conditions, your risk of taking another shot of this steroid can put you in big trouble. No more steroids. We need to get away from steroids. You know why doctors use them, folks? They're highly powerful and effective. They can give you immediate relief, but the side effects can take weeks to months to come along, and the doctor's long gone. Well, it wasn't my therapy now that you're diabetic and have cataracts and have overwhelming sepsis. It wasn't my treatment. Well, yeah, it was, and we know that now. So just, you know, what it comes from, folks, is today's doctors, they're so focused on drugs, they're not thinking about what heals people.
Well, when my original general practitioner, he was a wonderful doctor, never, gave me or pushed medication. And so he told, I had a lot of pain, and I would ask him, I said, Doctor, is Paget's disease painful? And he says to me, Anna, yes, it is. When it's active, it is very painful.
Yes.
So
that's what we need to do. That is of paramount importance. And there's hormonal treatments that help to control Paget's disease, and that's what you need to do. I also want to send you a few things to help you with your pain that will not interfere with your Paget's management. Mm-hmm. You know, one of the best things we can do is noni juice. Anna, do you know about noni juice?
Yeah, I know all about it. Yeah, I watch your program every single day when I'm at home.
Have you used noni juice?
I did. In fact, I ordered some from you a few years ago, and I don't know if it wasn't doing anything, or I didn't like the taste of it.
Well, no, it doesn't taste good. Here's what you can do with the noni to help with the taste. You can add a little root beer. You can add a little grape juice. Mm-hmm. What I do, and that covers it pretty well. Mm-hmm. What I do is I just add a little water to it, and it really cuts the taste. Mm-hmm. If you start drinking 4 to 5 ounces morning and evening, you're going to get some relief of pain. Now, it won't be complete relief, but the only thing that would completely relieve your pain would also make you very stuporous, and you wouldn't want to get out of bed. You know, a powerful narcotic, and I know you're not looking for that. You didn't make 94 by taking narcotics every day. So,
no, I took very good. I was one of those that took good care of my health, and I never ate sweets, and never ate a piece of cake, and never.
Uh-huh.
And I did take care of my health, and my mother was a very good cook. We didn't have all those sweets and all those other things that they have nowadays. We had good food.
Yes.
So, but, when I found out I had Paget's disease, it really, took a toll on me.
Yes.
And so, but then, let me tell you this. February 27th, I woke up at about 3 o'clock in the morning. I had the most horrific pain in my left hip. And I was crying out to the Lord to help me because I'm alone. My husband passed away 26 years ago. So finally, I was able to get back in bed. So a few days after that, I'm going to say this. All the while I've been going to the doctor for these injections, I said to the nurse practitioner, you people are giving me these injections and you really don't know what you're doing.
Well, you're right.
Why don't you have a MRI done? And she said, well, we're working on, we have one, the one that I had done 5 years ago.
Anna dear, we have hold on here. I hate to interrupt you.
That's okay.
But time is of the essence here. I want to send you the noni. I want to send you some goji juice, some glucosamine, chondroitin, MSM, things to help with arthritis and joint pains and this type of thing. But the key to your success is managing the Paget's disease. And as I understand it, you live in New York. There are thousands of great doctors in you. Find an expert in Paget's disease. They're assuming because you're old, you're not really eligible for treatment. That's not true anymore. People live a long time in today's world. Paget's disease. We'll be back. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-Pack. And remember, it's 50% off by the case. Give us a call at 888-442-1828 or go online at bioinnovations.net.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Our health depends on the choices we make every day, and few conditions are as dependent on our choices as diabetes. So here is your daily diabetic checklist. Number 1, take your diet seriously every day. Eat lean protein and leafy vegetables. Number 2, sugars and starches raise blood glucose, so reduce them in your diet. Number 3, check your blood glucose and record the readings every day. Number 4, take your medication daily and don't skip. And number 5, try to exercise every day. It will help you take off weight, which will help your body regulate blood sugar better. If you are diabetic, this is your quick daily checklist that could make life better. For Your Health at a Glance, I'm Dr. Richard Becker. Different people have different vitamin and mineral needs. That's why Dr. Becker's BioNutrients multiple vitamin and mineral powders come in 4 different blends.
That's right. When it comes to vitamins, no one formula is right for everyone. For those who don't get enough vegetables in their diet, there's the Organic Green Blend with 3 servings of vegetables in every tablespoon.
And for those looking for a boost of fruit and berry phytonutrients, there's the Berry Blend with 3 servings of fruit in every tablespoon.
And don't forget the Active Adult Blend with extra B vitamins, calcium, and added cofactors like ginkgo and CoQ10.
Plus, we've designed a multiple for those with allergies called the Low Allergy Rice Blend.
Whatever your unique needs are, BioNutrients has a multiple vitamin that's just right for you.
Give us a call at 888-442-1828 or order online at bioinnovations.net.
We're back taking your calls. Let's go to Georgia now and welcome Carol to the show. Hi, Carol.
Hi, Cindy. How are you?
Great.
Hey, Carol. What's on your mind?
Hi, Dr. Becker.
Hi.
I'm hoping you can help me figure out what's wrong with my leg. My left leg has no heat or cold sensation. It's been about a year or so. I was doing my normal walk. I walk about 2 miles every morning, trying to work off the stroke side effects and everything.
You've had a stroke.
Be healthy.
You've had a stroke.
I had a stroke in 2010.
Okay.
Right side.
On the same side that your hot and cold is compromised?
No, sir. That's my stroke was on the right side, and my left leg. It's my left leg that has no heat or cold sensation.
Okay, go on. Continue.
So, they said I had a high blood pressure, so they put me on all the pills.
Is it working? Is it controlling your pressure?
Absolutely. It's down. It normally runs about 117/77.
Okay.
So, and I take some, supplements and everything, trying to figure out what it is. I went to my primary, referred me to a neurologist. I had MRIs done. They don't know. They don't know.
So you haven't had a second stroke?
No.
No. Okay. Did they check your low back for disc disease or spinal stenosis or a problem in your spine? Because that can affect your perceptions in your legs.
Really?
Yeah.
They didn't. Well, when they did the MRI, they showed me, what they had, or what they found out, or what they saw.
Yes.
And I have scoliosis. I've had that since I was a child, but I'm a former Marine, so I deal with the pain and keep going.
That's amazing, Carol, because while you're telling me the story, I'm thinking this woman has discipline. She sees the job that needs to be done, and she gets it done, and if she can't do it, she improvises and moves on. And here you are, a Marine, the slogan of the Marines. Isn't that something?
Absolutely.
Good for you. And I want to compliment you on your discipline and your determination, because you know what? If we don't help ourselves, there ain't nobody going to help us. I mean, really, It's up to us to make things happen, right? That and our prayers, that's how we make it happen. Carol, it's possible that you've had a small stroke that's hard to see. I don't think that's it. But you could have a problem here with your scoliosis. I think that's what's doing it, because, the spinal nerves that come off the spine, they communicate with your autonomic nervous complex, and that's where a lot of this temperature control and perception of heat is through pain fibers, and that goes through the spine. What I'm trying to say is, as the spine twists and turns with scoliosis, it can put pressure on the nervous system, and you get all kinds of things, all kinds of weird symptoms. Now, let me ask you, if you were to put your toe on your left side, your foot and toe in a super hot bathtub, you wouldn't feel it, even to the point where you would scald yourself, you wouldn't feel it. Am I getting this right?
That is correct. That's what I tried that. I had my husband's foot massager thing, and I put really hot water in it, and I felt nothing. And
but you put your other side, your right foot in, and you go, that's hot.
Yeah, absolutely. That's what I did.
Now, are you African American?
Yes, sir, I am.
Okay. It would be unusual for an African American in Georgia, where we have higher vitamin D levels than Wisconsin, to have multiple sclerosis, but that can be a symptom of multiple sclerosis. But they scanned your head, right? That's one of the tests for MS, and no mention of that.
No mention of that.
Well, I think it's your spine.
At first, I thought it was just a pinched nerve, because
that's what you thought. I think you're thinking right. I think you're right.
That's what I was thinking. So I was telling my primary, I can't feel hot or cold on my leg, and she sent me to a neurologist.
Yeah. Well, you might need to see an orthopedic or a spine specialist who deals with the repercussions of scoliosis. Folks, what scoliosis is a twisting, a turning, a rotation, and a side bending of the spine. And when we do that, the two together, it can compromise the outlets of the nervous system throughout the spine. And when you pinch the spine like that, pinch the nervous system, you can get all sorts of unusual symptoms. And you've learned to live with pain because you've had this your whole life. And
yes, sir.
You may not realize how bad it is.
Maybe not.
You know, one of the things I would always tell my scoliosis patients is walking, jogging, and impact, like playing basketball or volleyball where you're jumping, and impact are not the exercises for you. Swimming, bicycling, maybe Pilates type of thing where you're not impacting, and you're probably walking on concrete, aren't you?
Yes, sir. It is concrete.
See, there's very little cushion in that. There's no cushion in concrete. Come on, your body is that impact every time, and it's really hard on the scoliosis patients. I know it's hard to swim. It's hard to have a pool handy, but in the South, it's easier than the North. I will say that. But a cycle, exercise cycle, is the better way to go. I think you should be evaluated for your scoliosis. I think you're right on. I think you're having a pinched nerve problem. And see, here's the thing: when you have a pinched nerve in the spinal column, you lose the perception of pain, and you lose hot, cold more likely, but it's not so painful. If the pinch is on the side, on the peripheral nerves, if that's where the pinch is, that becomes painful. Because, you know, the spinal cord and the brain have no pain fibers. So if you pinch it there, you get unusual symptoms. That would be my suggestion to you. I want to send you some things that help with pain. Noni juice, the glucosamine chondroitin. You may have arthritis because there's a lot of wear and tear on the spine. A good multiple vitamin, some vitamin D because we all need it, and Foundations for Healing. But that's my recommendation. See a spine specialist, and it will probably end with a good physical therapist to help open up your spine. I read of a young lady who had advanced scoliosis. She started doing yoga exercises, and her pain went away after a year or so of doing yoga. It really helped open her up, and it relieved her pain. That could happen for you too. Good luck with it.
I pray so.
All right, dear. Thank you for your call. We have a break. We'll be back. For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and Cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings. Here is our hope for you today. I'm Cindy Becker. Christian counselor Dr. Henry Brandt wrote, "To dwell above with the saints we love, that will be grace and glory. But to live below with the saints we know, well, that's another story." Throughout our lives, we encounter difficult people. These souls challenge the best of us. But the Apostle Paul suggested that we maintain our grace in spite of the actions of others. Paul wrote, "If it is possible, as far as it depends on you, live at peace with everyone." Paul acknowledged it may not be possible in all cases, but we should still do our best. Try to look at difficult people through Christ's eyes. Remember his sacrifice was for everyone, even those saints we know who challenge us. I'm Cindy Becker. This is our hope for you today.
There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out our AutoShip program for additional savings. We're back taking your calls. Let's go to Wisconsin now and welcome David. Hi there, David.
Hello.
Hello,
Hi.
David. How are you today?
Oh, I'm doing great. How are you?
We're doing all right. How can we help you, David?
Well, I've been dealing with ulcerative colitis for roughly 25 years now. I have at some point managed to not have to take medicine, but then I'll get flare-ups, and I'm just wondering if there's anything a person can do to just get rid of this problem.
Well, I don't know if it can be cured. We talk about ulcerative colitis and the inflammatory bowel disease kind of like we address cancers. And I'm not saying you have cancer, but we talk about remission and control. Because people have been known to get it under control, go into remission, and not have a single symptom for 10, 20 years, and then all of a sudden, boom, it flares up again and is back. So what are you doing? You managed to not have to use medicines. How have you done that? Tell me about what you do to control this condition.
Well, I just try to take a lot of different vitamins. I was taking a coral calcium, got rid of alcohol, just different things like that, and trying to improve it. And then it's just like I was slowly reducing my medicine until one day I didn't have to take it anymore.
Okay.
And then it would act up again, so I was taking a sulfasalazine, so I take some of that again, and it would kind of clear up. And I know if I didn't take vitamins and I didn't, keep very good track of everything, but it just sometimes it would work, and I wouldn't eat it for a while, and then maybe drinking alcohol would cause problems. I'm thinking, or maybe sugar. So I'm just trying to find ways to, I guess, eliminate. And I caught your show the other day, and it was just interesting listening to you talk, and so I wanted to see.
David, have you ever wondered if a certain food aggravates your condition? Let's say, for example, every time you eat potatoes, white potatoes, you have a flare-up. Have you ever noticed anything like that?
Dairy. I think dairy was probably the biggest, easiest, noticeable cause, I guess, of flare-up.
Have you tried eliminating wheat?
I did that some for a while, but I didn't do it for a very long term.
No difference?
Not at the time, because I do it when I was having problems. So I never eliminated it when I was healthy.
Well, let me ask this question, because it's probably the most important question. How do you know you have ulcerative colitis and not some other condition like gluten sensitivity? See, how do you know?
I went through all their tests.
Yeah.
On that machine, the barium thing or something they called it.
And a colonoscopy?
Yeah, head down, and yeah.
Okay.
So they diagnosed
all right.
it as that.
Are you taking vitamin D?
I just started again probably a month ago.
Okay.
That was one of the vitamins. I used to take a vitamin D, a calcium, coral calcium, vitamin C. I had like a handful of them that I was taking every day.
Right. Well, just some general thoughts about ulcerative colitis. This is a very disabling condition, and I want to say this from the start. Ulcerative colitis, Crohn's disease, they're not caused by food allergies. Okay? They're not caused by food intolerances and sensitivities. However, food allergies, food intolerances, and sensitivities can aggravate the condition beyond measure, make it much worse than it needs to be. Because there's all degrees of ulcerative colitis. There can be the person who has had one flare-up in their life, they're done, it's over, never have it again. Then there's a person who bleeds every single day through their rectum, and they're in desperate help, and they're anemic, and they're in a malabsorptive state, and it's so bad they have to have their intestines modified surgically. So it comes in all degrees. So if you're a person who is, let's say, intolerant or allergic to milk and dairy, and let's say that wheat makes your eyes itch, you're allergic to it, you put those foods on the ulcerative colitis intestinal tract, it's going to be much worse. Doesn't that make sense, David?
Yes, it does.
It does. So it is worth the effort to either do an elimination diet, and if you go online, you can read about elimination diets and how to do that, or to have allergy food sensitivity testing done. And it's probably best to do that through a blood test for you. And doctors do this type of thing. And that's available if you check it out. Go online and learn these things. It may be of great help to you. That's one thing to think about. The next thing is, typically the ulcerative colitis patient has frequent loose stools, and this leads to a malabsorptive syndrome. And if you live in the north, really anywhere in America, anywhere in the world now, I mean, everyone's vitamin D deficient. The further north you go, the more likely you're going to be deficient. You need high-dose vitamin D. There's no doubt about that. I would take 10,000 units a day for at least a month, and then about 5,000 a day, and I'd try to get my blood level of vitamin D to 70 nanograms, maybe even 80 with the autoimmune condition ulcerative colitis. Recently, it's been about 5 years ago, a group of researchers discovered that a mechanism to initiate ulcerative colitis is vitamin D deficiency had to be there. Low D levels, exposure to a certain strain of Salmonella, genetic susceptibility, those three things, and all three had to be there, triggered ulcerative colitis. That caused an epigenetic effect that introduced the gene, that allowed the gene to express itself. Now you have an apparent lifelong condition. My theory is if you correct those conditions, put that gene back into quiescence, you have a chance of going into remission, and it can last for decades. So vitamin D has to be present. But I also want to send you some things. Curcumin, fish oil, noni juice, mangosteen, cordyceps sinensis, the medicinal mushrooms. These are all things that will help improve the immune response, correct the dysbiosis that is inevitable with ulcerative colitis, and a good vitamin package. Our multiple vitamin and mineral powders, and some vitamin D to get you back into shape. And let's make you the best you can be, and let's put this thing into remission. And maybe you can have years, potentially, with a little blessing from above, decades of remission. What do you think? Is it worth a try?
That sounds like a good try. Now, I want to ask you...
Okay, quickly, because we have to go to break, so quickly.
Sure, the vitamin D, how should one take that? Should I take it all at once, or should I split it up?
I would take it daily. That's fine. You can even take it weekly. But your dose should equal 5,000 a day, 10,000 a day for a month, and then 5,000, and get your blood level checked. Get it around 70 or 80. That usually takes about 7,000 a day over time. And you can do that once a week. No longer than that, because your blood level will drop. We have a break. We'll be back. For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-1828. Call today.
I'm Dr. Richard Becker for Your Health at a Glance. Does acid reflux keep you hooked on antacids? If so, you may be suffering from GERD, which stands for gastroesophageal reflux disease. GERD affects at least 20% of the adult population. In fact, Americans spend hundreds of millions of dollars per year on medicines to treat GERD. This is unfortunate because these medications have side effects. They can cause additional digestive problems, and they lead to nutrient deficiencies, such as the depletion of vitamin B12. Fortunately, there are simple lifestyle changes that can reduce the symptoms of GERD. Avoid lying down or exercising within 2 hours of eating. Lose weight because obesity worsens symptoms. Limit foods that cause GERD, such as fried, fatty foods, mints, chocolate, and caffeine. To improve digestion, eat a diet rich in fiber, yogurt, and drink lots of water. For Your Health at a Glance, I'm Dr. Richard Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with GastroDefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-1828 and ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. We've had a fantastic hour, haven't we? Richard, the hour's just flown by. We had some really great calls today. Let's review them.
And medically important. I'm thinking of Ted in Louisiana with the methicillin-resistant Staph aureus. This is in the medical literature now, and I've seen it in my clinical experience. You have an infection, it cultures the staph germ, and you treat it for weeks and even months with the most expensive, highest power antibiotics known to man, and it still doesn't go away. What's changed, our understanding is that tissues that we used to think were sterile are not sterile. They're not sterile. Breast tissue, normal healthy breast tissue has bacteria in it. Normal muscle has bacteria in it, but it's not growing, it's not proliferating. You take a culture of it and put it out on the plate, you can get it to grow. So when we have an infection that doesn't want to go away, think yeast and fungi. Think yeast and fungi. If you treat that, you have success. What happens is you've got to understand the myco kingdom, the world of fungi is complex. They have more DNA than we have. They have more genes than we have. They are capable of changing shape and form, and they make poisons and toxins that confuse our system. It's really crazy when you study about it. It says, whoa, it's like it's from another world. But the truth is, when we have infections that don't go away, think yeast and fungus. And it's true in the gut, it's true post-operatively, it's true all around. So when you include the anti-yeast measures, then we gain success. And I'm thinking of over-medication, steroid injections, too many of them. Folks always ask, do I have an alternative to this steroid? Truth be told, a steroid can save your life. There's no doubt about that. But that's the short term. And they provide relief for a lot of people. But they're so powerful, we overuse them, and we pay a high price for that. So if 1 or 2 steroid injections hasn't done the trick, don't keep doing it. There's too many side effects, including serious life-threatening diseases, diabetes, etc. When we take charge, when we ask questions and we get involved and use dietary supplements and change our lifestyle and do the things such as David has done, he's learned how to control his ulcerative colitis, and his health has improved, as yours will too. Thank you for your kind attention. We'll see you tomorrow.
Thanks, everyone. We'll see you tomorrow. Bye-bye.
Aren't you glad for innovation? Things that used to be big and bulky, well, now they fit in your pocket. even your hose. The Silver Bullet. It's making other hoses obsolete. Just turn on the water and the Silver Bullet inflates from pocket size to super size. It's the hands-free hose that grows and grows. Turn off the water and it shrinks back to a super light pocket hose. It's putting itself away. The other hose, it just sits there. Come on, go. Get your 25-foot pocket hose Silver Bullet today. Still just $19.99. You also get our adjustable bullet nozzle, a $20 value, absolutely free. Order now and you can double it to 2. Just pay a separate fee. This offer is not available on Amazon. Get the original pocket hose Silver Bullet today.
Call 1-800-713-1689. That's 1-800-713-1689. Or visit silverbullethose.com. So call 1-800-713-1689 now.
Hi, it's me, Anthony Sullivan, and